is April Chen. You all know me, most everybody. A licensed master social worker. One of my specialties is working with kids in the school system. It actually started from a personal perspective, working with my daughter and advocating for them on the IEP. I've sat in on a couple of IEP meetings throughout my career and kind of helped advocate, because a lot of times therapists are the first to notice when a kiddo is like struggling emotionally. So what we found is that if they're struggling emotionally, socially, or academically, these challenges show up in school. And actually wanted to bring to your attention an article I just read, and I recorded like an educational thing that I sent over to Frankie about it. But we are seeing epidemics of increased like DMDD, like disruptive mood dysregulation disorder. Sometimes neuropsychiatry or neuropsychologists call it oppositional defiant disorder. And what I'm finding with some of the kiddos I work with too is that they're being placed in, like, allowed to use a lot of technology, and it increases their anxiety, depression, self-harming behaviors, all those things. So as therapists, we're like the first ones to notice. And if we understand the basics of school advocacy, we can serve as crucial bridges, right, between families and schools and ensure that kids' needs are met. Because sometimes with class sizes, especially in the different, Montgomery County being large, Howard County being large, PG County being large, the kids that are on IEPs and 504s kind of get lost in the system. And so that's how we as therapists, I was thinking, could identify some of that. What today's presentation will discuss is, when should we recommend a neuropsychological evaluation? I don't know what you guys understand about things, so this is kind of going to pose a question. Do you guys understand the difference between an IEP and a 504 plan?
My understanding of it is that the IEP is for the academic piece and the accommodations that the child would need academically, and the 504 is a behavior plan.
That's definitely correct. Hey, Chris, go ahead.
From my experience, I was in IEP since when I was young, so it's a lot of extra help, and it's just more person. From my experience, it was like they give you extra time and just very engageful and mindful of your situation. So like taking things a little bit slower compared to other students who get things quickly. So that's my experience.
That's awesome, Chris. Thank you very much. That's one of the things. So 504 plans are usually for what they call OHI, which stands for other health impairment. So like things like ADHD or cognitive processing difficulties, those are usually in a 504. If it's a behavioral issue, like as Chelsea said, the IEP addresses, it kind of goes deeper. Like usually what, in my experience, what I've found is the schools will start kids off on a 504 and they'll do their educational assessments, right? But there's a missing piece in a lot of these cases, and that's when the neuropsychological becomes important. So some of the red flags that kind of warrant looking at that is things like behavioral disruption in the classroom. There's times when children don't reach their goals and their test scores are kind of not reflecting it. The state tests are showing a discrepancy despite these things being written in the IEP or the 504 plan. So that's when we talk about a neuropsychological evaluation. So yes, the 504 plan provides the behavioral supports and educational accommodations like preferential seating and all those things, but then it advances with the IEP and it's specialized instruction. They measure the progress, they do benchmarks, and they attempt to do individualized instruction. However, sometimes in some of these cases, what happens is that the child's needs are not being met. And so that's when I feel like, as a professional, I will ask the parents, how do you feel about getting a neuropsychological evaluation? Because the school system kind of sticks with just doing the educational assessment piece, right? So there's signs, like in some cases, where the current supports written up in the school plans or the accommodations don't fully address everything. And you can see in the parent report, Vanderbilt assessment in the case of ADHD, that they're not actually addressing everything. Some of the overlapping clinical things can include ADHD, autism, trauma, and developmental learning disabilities, because there's a co-occurrence of those, right? So when there's a significant gap between potential and actual performance, or unexplained difficulties in specific areas, behaviors present like aggression, withdrawal, like school refusal, things like that, and impulsivity, and they don't improve, given the standard interventions that are written into these plans, that's when I usually recommend a neuropsychological evaluation. So I thought that it would be important to talk about that. When there's unclear diagnostics or complex presentations, like I was mentioning, and then emotional and behavioral challenges that are impacting their learning within the school environment. So if we suspect some cognitive issue or some developmental delay that has not been diagnosed, sometimes when we're talking about transitions from, say, elementary to middle, or middle to high school, or even high school and beyond, because the IEP in 504 can be implemented in the college environment as well. They have offices for disability accommodation. And then lastly, but definitely not least, parents or educators, if they, show concerns. We always try to make sure, and it's important, as you guys know, to have the individuals we communicate with have that release of information in the client chart. So we do that. A school-based psychoeducational evaluation is also very limited. They only stick to like Woodcock-Johnson and other educational assessments, and there's a lack of differential diagnosis. It's minimal brain-based assessment. So if we see a client that is exhibiting issues like processing things, or they won't engage, or things like that, and that's reported with school, that's when a neuropsychological is very, very helpful. The downside to it is that there are limited neuropsychologists in the community that accept Medicaid. Kendi Krieger is one, but the wait time is very extensive for Kendi Krieger, and they will not sit in on an IEP meeting. So then that kind of leaves a gap as well. At the end of the presentation, there will be some resources shared for when we have low-income clients that cannot afford out-of-pocket. Because last I checked, the neuropsychological evaluation is something like $2,000 or more, and you could submit to insurance, but Medicaid typically does not cover it. However, as I said, there are some organizations that take care of that for the families based on income, and some that offer sliding scale. So we talked about that. So these are some questions I have. In your clinical practice, in what ways have you observed social, emotional, or academic struggles when you work with kids?
What comes to mind is very, very short attentive span. I think it's the way I was born in 2000, and so I kind of was 50-50 with technology and more traditional, like going outside, but it still applies today. But what I'm trying to say, a lot of my influence was technology, and so I'm just reflecting on like how the technology help kind of has its pro and cons, and the con side is the constant scrolling, the 7-second videos and all of those. I feel like very short attentive span.
That's awesome, Chris, because it leads me right to the point of saying that, I read an article and did a little education piece, but I read an article that there has been a huge increase in depression, anxiety, and other mood disorders when children have unlimited screen time. And that happens in a lot of cases. I have several that this is going on with. And, you can only gently suggest, when you do what Laura used to call sandwich therapy, right? You can only gently suggest to the parents, hey, let's get the kids involved with some creativity. let's limit screen time, because the American Academy of Pediatrics recommends 1 hour of screen time per day. But if we're going to use screen time, let's use it creatively. Let's do something creative. Let's be engaged in things besides the doom scrolling, because there is a definite correlation between anxiety, depression, and other mood disorders.
I'm sorry, I missed a question. Did you say how does that show up in our sessions?
Yeah. So in what ways have you observed social, emotional, or academic struggles when you work with kids?
Yeah, I was gonna kind of piggyback on the attention span, but like some of them are just always moving during the session. They're just not able to sit still or stay in one position. So I think that is one thing. Sometimes if you are doing some type of digital activity and they might have to read something, sometimes it can come out there in terms of some of their academic or cognitive abilities, or even sometimes just in their language and their ability to actually express and articulate their thoughts.
That's awesome, Angela, because one of the things I do, and I don't know if you guys do this, but I work with a lot of ADHD kiddos, and if they're telehealth or in the office, I seriously will have them like stand up and do like 20 jumping jacks or run in place or do some kind of movement. And then I notice that they can attend a little better. Something else I do is give them fidgets during session, because I think it helps them attend a little better. So I'll, give them those things, and that's some of the things I do. How do you guys, if you do, communicate with schools about IEP or 504 plan accommodations? Anyone have experience doing that?
I did it as a clinical case manager for the Maryland REM Medicaid program. That was just part of what we had to do. And sometimes the school would push back and they would not want to get involved. They didn't want to pay for the child to get what they needed. And I would often make a referral. I don't know how good they are with doing this now, but the Parents Place of Maryland, they offer, or they did, legal advocates that are free to the parent, and they would actually get involved and intervene with the school, and then the school would do what they asked. I sat in on a lot of IEPs, got kids into I can't even remember the name of it now, residential and school facility through a voluntary placement. Lots of work. That's lots of work. I don't know if any of that's helpful, but I can put the Parents Place link in the chat.
Thank you so much, Chelsea. It's actually on the resources at the end of the slide, because I called them to see if they still did it. Because I was like, I don't know if you guys still do it, and it seems like that they do, because I did my homework and a little research. So the next slide has tons of resources. There's also the ARC of Central Maryland, and there's some others for low income as well. So I'll share those after the questions. But that's an awesome thing that you have experience doing that. I've written several letters, like kind of just gently saying, okay, X client is doing this, that, or the other. These are the recommended accommodations. But the thing that I found out, and I found this out at the previous practice I was at, is that a lot of times we have to loop in our nurse practitioners, because as social workers and therapists, the Maryland State Department of Education does not have to abide by what we suggest or recommend, even if you are an LCSW or an LCPC. They want someone with a medical license. So this is where collaborating with the nurse practitioners comes in. And so I'm glad Medicaid makes them have an evaluation, because if they're not on medication, you can then say, okay, hey, ex-nurse practitioner, would you please sign off on this? And most of our NPs are really great about doing that. So that's kind of how we can, as an organization, collaborate, right, to help provide for our kids. So the next question is, if you communicate, what barriers have you encountered either with parents or the school system?
Well, I work in this. I've done a lot of work in the school system on the education side, and it is really, really, really hard nowadays to really get into the special education system. Even with those recommendations, they have so many other things that they want to do before they put a child in special education, before they give them that IEP or that 504 plan. So you might be distressed as a therapist. We're not, kind of distressed about where the child is and them getting extra services. But the school system is pushing back and saying, hey, well, we're going to try this. We're going to try and get them a tutor. We're going to offer them this after school program. We're going to do all of these other things. We're going to give them extra help on the homework, or we're going to modify their assignments. We're going to do this for like 3 months, and then we'll reevaluate and see what we need. So my experience is that it could just kind of take a while dealing with the school. Yeah, that's just my experience.
That's awesome, Angela, because that's absolutely true. Like, even with the neuropsychological assessment, which it does take some time to kind of get that done. It's probably, especially for our kids with ADHD, it's 2 or 3 appointments, because it's a battery of testing. And being able to speak to the neuropsychologist, it kind of helps us formulate diagnostics too. But if we write letters, like there's a few I've written to kind of help when kids are just doing things like school refusal. Don't want to get too specific about cases, but I have seen in practice where the class sizes are just too large for the kids. You have a child with special education needs, and say there's 26 children in the classroom. Even if they do the pullouts and they do the educational things, it still sometimes leaves some kids behind. So in those cases, it's important to kind of get an educational advocate on board, because we're super busy. We can't do all the advocacy, but we can when we listen in on IEP meetings. Like, think through that process, because educational advocacy is a really important part of helping you succeed in school.
Yeah. And you saying that kind of brings up to me like the parent, because if that were my experience, then I'm kind of want to go back to the parent and say, hey, is this the best educational institution for your child? You can't change the school. If their class sizes are average of 26, they're not going to make a class of 5 for you, And so is there someplace else that you can go? And that's where you can kind of get into challenges with parents, because they are, maybe tied to that school for other reasons.
Yeah, absolutely, Angela. And I don't know if you guys know about it's called MANSEF, the Maryland Association of Non-Public Special Education Foundation, or something it stands for. But if you look at MANSEF, I'll put it in the chat as MANSEF. You can just Google it. These are schools that are specifically made for things like kids with, like Vashti's saying, noise sensitivity. There's a disorder called sensory processing disorder. Like, sometimes they have anxiety, they have hyperactivity, they have noise sensitivity. So some of the recommendations I've written before is little simple things like allowing them to have headphones so that they can do calming activities. Because with ADHD, there's a lot of studies that prove that listening to music, and I know from a personal perspective, if I'm in the middle of something where I have to really focus, listening to music is super, super helpful. Like, I blasted music in grad school to get through the papers. And so I suggest that to parents. I say, if your child is having trouble with homework and they're ADHD, give them some music to listen to and see if that changes things. But how do we know, and what are your thoughts on when to refer a child for a neuropsychological assessment? Any thoughts?
When their behavior just becomes when you see a really impact on their kind of day-to-day function, when you hear that impact of, you might see a child that is somewhat distracted, but then you have that child who is failing all of my classes because I just can't concentrate and I just can't pay attention to the teacher. Or I'm getting into fights with all of the kids. Every week they're coming and they have a new person that they're arguing with or a new situation. When you just start to see those repeated patterns and you see that they it's really impacting different areas of their main functioning.
And that's absolutely true. I did share in the chat this presentation because at the end there's some resources to recommend. Have any of you ever worked with a child who seems stuck and then you later learned upon reflection that, you know, this school assessment can be so limited and it misses critical areas like executive functioning and processing speed and just other cognitive delays? I just want to hear if there's ever been anyone. So that happens. You'll notice that you'll ask them a question and it doesn't quite register. And that's when I usually recommend a neuropsychological because they do, you know, more intense testing. How would you as a therapist explain the purpose of the neuropsychological assessment? Any thoughts on that to a parent if they're hesitant or overwhelmed with everything?
For me, I work in a Hispanic community, and so it's good to clarify that nothing is wrong with your children. You know, it's being mindful of that. It's okay, because I remember as a kid, I had like a poor view of being in these IEP, and my mom did her best, but I thought I was in a way lower, less than, and that affected my esteem. And so I think it's just clarifying that each individual, each person's brain is different. You know, you gotta work with the tools. You know, a hammer won't work well to break wood. You know, a chainsaw does. Hammer can break the wood, but you need the right tools. So that's my input.
I like that, Chris. I like it because we validate that this kiddo is there's nothing wrong with them. They just have a learning difference because everyone learns differently. Like I'm sure across the board as therapists, we can all say that we learned this job very differently, or we learned things very differently. So that's kind of where I come from with this, you know, is just kind of explaining this will help your child, you know. And as we conclude, these are some resources. I did share this presentation, but these are some ones here. When you're looking at accommodations for kids, the children and adults with attention deficit hyperactivity disorder, chad.org is a really good one. Then Wright's Law is a special education advocacy page that was actually started. The Maryland State Department of Education has family advocacy resources listed. Then this one, Empower ED, I found, Empower Ed, accepts Medicaid for educational advocates because they go further, right, in advocating in an IEP. They know how to read all of the assessments and the school things that can be really complex. So then the ARC of Central Maryland does that. And then here's some very interesting, if you work with clients with ADHD. I actually found this and I'm going to be exploring it more, but this is about ADHD science and strategies, and it has a bunch of downloads to help our clients with that.